They're talking about marijuana at the state capitol. Efforts to decriminalize pot use could come up again before lawmakers break for the summer. And as if that's not hot enough, lawmakers are going at it over a plan that would let prisoners earn time off their sentences for going through self-improvement programs. And the governor wants to spend some money to make some money, but not everyone thinks the Yukon Health Center expansion plan is the way to go. Welcome to The Real Story. I'm Lori Perez. There is a serious pace at the Capitol these days as lawmakers head toward summer break, which is supposed to start this coming Thursday. Of course, with some uncertainty about the budget deal the governor made with union leadership and the lack of a union vote on ratification just yet, lawmakers might be back for more in a special session. But in the meantime, there is plenty of other work to be done and lots of debating. First up today, we talked to Senator Toni Boucher about efforts to decriminalize the use of marijuana. As you will see, she is fired up and ready to fight this till the end. Here with Senator Toni Boucher to talk about two different bills that deal with legalizing marijuana, one for medical use and the other decriminalizing the use of or the possession of pot, less than 1 ounce. And you've been a staunch opponent of both bills, and talk to me about why.
Yes, well, for me it is the same issue. It's the step in legalizing drugs in general, particularly marijuana. And it comes on the heels of legislation that the public just simply cannot believe. We are reducing sentences and letting criminals out early for violent crimes in order to save money. We are using accelerated rehabilitation for individuals that molest young girls and children. This is something that really affects the safety of the general public.
But just one point, though. I think that some people would put in completely different categories a violent offense and possession of less than amounts of marijuana. I mean, perhaps you would not, but I think that would be their argument.
Right, and that's really the misconception. Quite frankly, marijuana is a Schedule I drug, as bad as heroin in the eyes of the federal government. And they have just recently, in the last 2 months, the Department of Justice has sent letters to the attorney generals of other states that are moving down this path, telling them directly that they will prosecute not only individuals, state workers, but those that use and possess, including those for medical purposes. Unfortunately, the proponents of this are going from state to state, using the issue of medical marijuana as a red herring for legalizing drugs in general. You'll see that in California, you'll see that in other states. And other states that have medical marijuana and dispensaries are now finding that the drug cartels have moved into their state and they're trying to undo the damage that's already been done. The increase in use has skyrocketed. Crime has increased substantially. This is not a benign drug like it used to be in the 60s and 70s that people make jokes about. It is anywhere from 10 to 29% more potent than ever before. It damages the lungs, the heart, the immune system, and also the brain. In fact, it deposits itself in the two fattiest areas of the body, the brain and also the sexual organs of individuals. It also gets into your DNA and can skip even a generation in some of the damage it does. We're learning so much more about this than ever before. And in fact, the very proponent, one of the great leaders of this movement, the Marijuana Project individual, is now dying of lung cancer himself purportedly from doctors and so on, from his heavy marijuana use. It is definitely a health hazard. It's also addictive now where it might have not been in the past. In fact, 60% of the admittances in our treatment centers in Connecticut contributed to marijuana addiction, particularly amongst our young. And the message this is sending to them has been so damaging. They'll come in and say, well, this is not supposed to be a danger to me. It's benign. Some people are calling it medicine. I had quite a lengthy debate with the previous Senator Mike Lawler, who is continuing to propose this and push this through the governor's office. And in fact, this is one of the governor's initiatives in his budget, along with granting in-state tuition for illegal immigrants and all of these early release bills as well, which is a big, big concern. And when I debated it with then Representative Waller, with both a Dr. Pro and a Dr. Con on the issue of medical marijuana. The doctor that had originally prescribed it in California was going to promote it, changed her mind completely and said, now that we know what we know about a smoke-filled lung, whatever the source, I cannot, in good conscience as a doctor, prescribe this. And especially given that it is 5 times more lethal than one cigarette. So we are now working so hard to ban smoking and secondhand smoke, and yet we are encouraging people, for whatever ailment it may be, to put smoke in their lungs that is 5 times more damaging and in fact will give you the same unfortunate results on your health. So it's disingenuous to say it. Now, on the other hand,
if I could just interrupt for 1 second. I mean, there is, obviously there's medical dissension about the use of medical marijuana for medical uses. I mean, would you be amenable if there were more restrictions on exactly how it were prescribed or how it were given out or how it were?
Absolutely. In fact, I've even gone to the proponents and said, if you want to relieve the pain of someone that will not get better, will be terminal, I'm on that amendment with you. I'm fine with that, because if someone is terminal, we're not concerned about the long-term damage, because they just need relief at that point. Even though we have at least 30 some odd stronger and better pain medications now, and why there is, by the way, a pill, a medical form of the THC in marijuana called Marinol. It comes with a whole bunch of disclaimers on it talking about the damage it does to all of the rest of your body. But you can still prescribe it, and it does take and extract some of the properties, and you can dose it properly without overdosing someone. However, the proponents are using the argument of all kinds of chronic illnesses. And by the way, things like cancer and glaucoma and MS, the very societies that advocate on them have come out strongly against using smoked marijuana as somehow a way to help their condition, because it gives them other things that harm them more. So again, if you want to live a longer life, you're going to get over an illness, or you're going to have a chronic illness for the rest of your life. You don't want something that is going to debilitate you further so you can't function or work. And in the worst cases, it masks other medical problems that are developing in the body, and thereby they're not getting the medical treatment that they need.
Okay, so there's continuing dissent about the medical use and the medical benefits and contradictions there. But going back to decriminalizing for possession, the governor has said that, we're in this losing drug battle. This'll.
But we're not. We're not losing the drug battle. In fact, we've shown for over a period of years when we've gotten tough on this, we actually saw quite a decrease in the usage. It has gone up precipitously in states that have moved in this direction, because the perception of harm is gone. Now, when the federal government, when they have someone that's maybe more sympathetic in the presidential office, has reversed that position to be tough on this as well, they have a preponderance of information to show that this is going to be a costly issue for states in their healthcare system and in their criminal system. Over 80%, it doesn't mean that this is going away. We just give up. In fact, in places where they have given up, they've saw an incredible increase in use and in crime. Very costly to state agencies, to the Department of Social Services, to children and families, where we have 80% of our foster children are coming out of a drug-addicted home. This is one of the largest health hazards and issues we have, drug abuse, and this just promotes it and makes it worse.
All right. Well, we can see that you're very passionate about it. We appreciate you taking the time. Thanks.
Thank you.
Up next, Senator John Kissel talks about what he calls a dangerous plan to reward prisoners.